Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic with data accurate through June 10th, 2021. This week, as always, I'm going to start with updating the progress of the pandemic and then ask the question, what do we know about the Delta variant that's been in the news this week? The pandemic is continuing to progress, 3.8 million deaths worldwide, but only 1.9% increase in the past week. You may recall we've been following the week-to-week increase to see whether the pandemic is speeding up or slowing down. And 1.9% is the lowest we've ever had, at least among reported data. So that's good news. The pandemic appears to be slowing down, but even with this, that's 70,000 estimated deaths worldwide. That's about 7 deaths every minute. So while the pandemic may be beginning to slow down, it certainly hasn't come to an end. If you look at the number of daily deaths, and the brown line is the weekly average, you can see that it's been coming down for about a month now, but now it appears to be leveling off, possibly even picking up a little bit. And also, it's important to point out that while it's down from its peak, it's certainly way ahead of still, the number of daily deaths is still way ahead of where it was from March through November of last year, when the pandemic was seen to be a very serious public health issue. Here are the countries in the world with over 1,500 deaths per million. 21 of them in the U.S. is ranked 12th. In the U.S., we've seen this slowing. You can see the pandemic began in March, April, pretty fast growth there. Then it grew again in November, December, and then it's been slowing down pretty significantly. Since then, about 600,000 deaths in the U.S., a very significant number. And last week, about a 0.4% week-to-week increase. Again, that's the lowest increase we've seen in the last couple of weeks, 0.6, 0.7, 0.8, 0.4. The subtle variations week to week are to be expected, but hopefully this is a signal that the pandemic is slowing down in our country. But even with this, 2,500 deaths last week and about 350 deaths every day. That's about 15 deaths an hour. So again, while we can say it's slowing down, it's important to reiterate that this is a pandemic that hasn't gone away yet. In terms of new deaths, you can see this spike pattern that came up in March and April, a little bit of a bump in the summertime, and then obviously this huge, expansive explosion November, December, January, February. It's been coming down since then and is now at its lowest level since March of 2020. But again, as always, we want to be a little bit careful about declaring victory too soon, because this number is not yet zero, right? In terms of our region, about 2,100 deaths from the Ballot Health Service area, about a 0.7% increase last week. That's about the rate it's been growing the last couple of weeks. 14 deaths last week, that's 2 deaths every day. So again, even in our region, the pandemic is slowing down, but it has not gone away. In terms of hospitalizations, we're about 1/10 of the number that we had back towards the end of the year, which is wonderful. But again, it's not zero. And so 36 hospitalizations is still a sign that we have an ongoing epidemic. Now, we hope that what we're seeing is slowing of the pandemic globally in the U.S. and in our region, though we're not absolutely sure that's what we're seeing. One of the issues of concern, as we have talked about many, many times, is not the probability, the absolute certainty that as long as the virus continues to spread, it will mutate. And we have a new variant that's been in the news lately called the Delta variant. This has nothing to do with the Delta region or Delta Airlines or anything else. It's just a new nomenclature from the WHO. It was first identified in India in December of last year. It was called the Indian variant for a while, or B.1.617.2, now known as the Delta variant. It is now the dominant strain in the United Kingdom and in India, and it appears to be impacting younger people in the UK. It's something worth watching. Obviously, the young folks are the ones who haven't been vaccinated and haven't been previously exposed. So we have to see whether this is just a coincidence or whether there's something about this variant we need to learn about. It's been identified in over 60 countries and represents somewhere between 5 and 10% of confirmed variants in the United States. Well, why are we worried about the Delta variant? Well, first of all, it appears to have increased transmissibility. That is, it's easier to spread from one person to another. That worries us. It may also have increasingly severe disease. It appears some preliminary studies out of England suggest that people that get the Delta variant may be sicker than those that had the other variants for it. Now, it appears to be responsive to 2 doses of the mRNA vaccine, but less responsive to a single dose. Now, whether this is an observation that will change over time, I don't know, but it's certainly important. If you haven't been vaccinated, you need to get vaccinated. And if you've only had 1 dose, you need to get your second dose of the mRNA vaccine. This could potentially be very serious. And one of the things we've said all along is as long as this virus continues to spread, it will inevitably evolve. And as it evolves, it is possible that there will be variants that are increasingly serious, that cause serious disease, that are easier to spread between people, and could be able to avoid our immune system. It is really, really important that we don't give up the fight just yet. This pandemic is not over. We need to take it seriously. We need to get vaccinated. If you have loved ones who haven't been vaccinated, please talk to them about getting vaccinated. The time has not come that we can throw up our hands and say that we've been victorious. The pandemic is still evolving. It's slowing down, but if this Delta variant is as serious as folks suggest, we could see a resurgence. So the pandemic appears to be slowing down globally, certainly in the US and hopefully in our region. The Delta variant is a not unexpected but worrisome variant of the virus. It appears to be causing disease, significant disease in England, India, and other countries. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. As always, I'd like to thank Dara Young for editing, producing, and posting this video. And if you have any questions about these videos, about COVID-19, or any other aspect of this pandemic, please let me know. I look forward to answering your questions. Until then, please be well. Thank you very much.